The principles of pharmacology is very important to know as a paramedic. There are so many aspects of pharmacology that we must know and understand so that we can perform our job safely and correctly. Before we had actual science and medications that were FDA approved, people used to use homeopathic medicine to help the sick and injured. They would use perfumes, oils, roots, herbs, and even flowers to make their own medicine. The first actual medication was invented in the 17th century, which was a painkiller called opium. Back then there was no such thing as accurate dosages, and then came the 20th century, and we grew and started learning more about different drugs and how important the use of accurate dosages were. Medication safety is extremely important in any medical profession, and as a paramedic, one must know how important it is to know medication safety. Before scientists knew how important it was to have correct dosages of medications and the side effects of certain medications, doctors used to just guess on how much of a medication the patient should have. We know now that that was very dangerous. Back then, the ingredients didn't have to be put on a bottle or side effects didn't have to be disclosed. Now we have the Pure Food and Drug Act, which makes the drug companies liable for what they put on the shelves for us to buy and what doctors give us when we are sick. Our country has standards of medications, which means we always get to know the side effects and the ingredients of the medication. Also, the FDA, or the Food and Drug Administration, helps with medication safety because any drug company that sells prescription medication must have approval by the FDA that it is safe for people to consume. There are vitamins and pills out there that aren't FDA approved, but are over-the-counter medication, and it has to say on the bottle it is not FDA approved. There are 4 drug names when it comes to a medication. The chemical name, which we won't have to ever use, is made by scientists who created the drug, usually has letters and numbers as shown in the slide. The generic name of a drug is usually way cheaper, but is the same type of medication. They also usually have the same potency as the non-generic drug. The trade name is a name designed by the company and usually more expensive because it's name brand. Lastly, we have the official name, which is usually the same as the generic drug but always has USP behind it. USP stands for United States Pharmacopoeia, or NF, National Formulary. Important terms to know that are necessary to interpret information in drug references safely. First, you have antagonism. An antagonism is the opposition of effects between 2 or more medications. Then we have contraindications. This is talking about the medical factors that make it harmful to administer a medication. We also have cumulative action. This is the tendency for repeated doses of a drug to accumulate causes negative side effect or overdose. Next, we have the term depressant. A depressant is a medication or substance that decreases bodily function or activity. We also need to know drug allergy. A drug allergy is a systemic reaction to a drug resulting previous exposure to a substance. Drug dependency is a state of withdrawal that causes physical and psychological disturbances. Then we have drug interaction. This is how drugs work together, both positively and negatively. We also have idiosyncrasy, meaning an abnormal response to a drug. We also have potentiation. This is when there is an enhanced effect caused by the administration of two drugs in which one increases the effect of the other. A side effect is the undesirable effect of a medication. Then we also have stimulants. Stimulants are drugs that enhance body functions. Summation. This is the sum of the effect of two drugs. We also have synergism. This is the combined action of two drugs. Therapeutic action is another term that we need to know. This is the desired action or what you want to see happen while taking a drug. Tolerance. The tolerance is the decreased response to a repeated administration of a drug. Lastly, we have untoward effect. An untoward effect is a side effect that proves harmful to the patient. Factors that influence drug absorption, distribution, and elimination. The absorption factors. The drugs must pass through the intestines, and transport is faster if the drug doesn't have to pass through several layers of cells. The larger surface area of the absorption site, the greater effect of the medication. Blood flow to the site of the administration matters because a rich blood supply enhances how the drug is absorbed throughout the body, and we want as much absorbed as possible. The solubility of a drug matters because the more soluble the drug is, the faster it absorbs into the body. For example, an oily solution absorbs slower than drugs that are dissolved in water or normal saline. The drug concentration matters because higher concentrations of a drug absorb more rapidly than the low concentrations. The form of the drug dosage matters in the absorption because medications resist digestion, so it takes longer for absorption. Distribution is the transport of a drug through the bloodstream. There are three factors of distribution of a drug, one being drug reservoirs. This means that over time, a drug can create a reservoir in certain locations in the body, and when the drug levels get low, the drug reservoirs keep the drug levels in the body at the correct level. Then we have barriers to drug distribution. This means that a drug cannot cross certain barriers. For example, the blood-brain barrier and the placental barrier. The blood-brain barrier will only allow lipid-soluble drugs enter, such as general anesthetics. The placental barrier. This separates the mother and the fetus. But even though it offers some protection, it does protect against steroids, narcotics, and anesthesias, and some antibiotics. These can potentially harm the fetus. Then we have biotransformation. Biotransformation is another factor that influences drugs. This is the way the body eliminates drugs. First, biotransformation and then excretion. Biotransformation is a metabolism process in which drugs are converted into smaller components. This is a detoxifying process that makes the drug less active. Once a patient takes a drug, it goes throughout the body until it reaches the liver. Once it reaches the liver, it loses up to 50% of the drug's availability to the body. This is called first-pass metabolism. If someone is needing a medication's full effect, then it can be given in a higher dosage because it goes through the liver. The potency of the medication significantly drops, and you won't see the desired effects if not given in a higher dose. There are several excretion factors. Excretion means eliminating toxic or inactive metabolites. The kidneys are the main organ for excretion. Drugs can be eliminated through the urine. Then we have excretion by the intestines, which means the drug can be eliminated through feces, and whatever is left will enter the bloodstream, back through the liver, and excreted through the kidneys. Drugs can be sweated out, but that's not very important. Excretion by the mammary glands means a drug can be excreted through the breast milk. We have to be very careful with that because whatever we're taking, and if you're breastfeeding, that can be crossed over through your breast milk and can be transferred to your infant. Now let's talk about the routes of drug administration. The first being enteral routes. This means any medication taken by mouth or administered through any portion of the GI tract. The enteral route is the slowest but safest route of administration. Next, we have the parenteral administration route. This route is through injections. There are many ways you can give injection administration. Subcutaneous, intramuscular, intravenous, intradermal, and intraosseous. The first being subcutaneous. Subcutaneous means fatty tissue. So subcutaneous injections means you're penetrating the epidermis all the way to the soft fatty tissue to administer medication. Then we have intramuscular injections. Intramuscular meaning into the muscle. So you're penetrating the muscle to administer the medication. Intravenous injections means administering medication through the vein into the bloodstream. We also have intradermal administration. This means administration of a medication just right under the epidermis. TB skin tests are performed this way. Also, allergy testing. Then we have intraosseous injections. This meaning drug administration into the bone marrow. So you'll drill a hole until you enter the bone marrow, and the medication can be pressure infused into the bone marrow. Other drug routes would be the pulmonary route, which are inhalers or breathing treatments. You're getting the medication through inhaling the medication through a gas or mist. Then we have topical routes, which can be skin and the nasal area. A lot of people use nicotine patches or fentanyl patches for pain. Then others can also use nasal drops or sprays for allergies or dry membranes. How drugs react with receptors to produce desired effects. It's believed that most drugs bind to drug receptors to produce desired effects. The relationship of a drug to its receptor may be thought of like a key fitted into a lock. The better the fit, the better response of the drug. And as you can see on this picture right here, B is the better fit. There are many factors that influence drug interactions. How well the intestines absorb the medication, plasma protein binding, biotransformation, or how much of the medication is your body actually getting. Is the medication fitting into the receptor like a lock and key? Is your body getting rid of inactive medication like it should? Other factors that influence drug interactions would be, for example, is the person eating with the medication? Can you even eat before taking the medication? Is there certain foods to avoid with my medication? For example, grapefruit has to be avoided with certain medications because it can boost blood levels as much as 1000% and can also inhibit certain drugs. There are many drugs that say you shouldn't drink alcohol because it will increase the side effects of the medication that you're taking. And smoking can cause blood clots when you're taking birth control. Paramedics should know drug profiles, but there is no way to know every one. So paramedics must use their pharmacology references and seek medical direction as needed. Paramedics are legally bound to provide safe and effective drug administration. Being a part of the professional practice of patient management, paramedics must be vigilant to the side effects of the drugs being administered. Always be professional and kind to the patient. Always assess your patient properly. Always gather the necessary drug history of the patient. Document all of your findings and what the patient tells you. Document everything you gave to the patient medication-wise. And document the effects that the medication had on your patient. Components of a drug file. You'll have drug names. This is usually the generic and the trade names, but it can also include chemical names. You'll also have the classification, which is the group of which the drug belongs to. You'll also have mechanism of action, and that is the way in which a drug causes its effects. Indications, conditions for which the drug is administered, and it has to be approved by the FDA. Pharmacokinetics, that is how the body handles the drug over a period of time. Then you'll have side effects, and that just means the good and the bad effects that can be caused by the drug. You'll have the dosages, and that's just the amount of the drug to be administered. We've also talked about the routes of administration, and that's how the drug is given. Contraindications is just the condition in which it may be harmful, the drug. We'll also have special considerations, and that's just how the drug may affect pediatric patients, older people, and pregnant patients. And then storage requirements, just pretty basic, just means how is that medication supposed to be stored. Now we're going to talk about drug forms. There are several drug forms to know. This one is the oral drug form. They can be solutions, suspensions, emulsions, or extracts. They're either going to be liquids or solids. Your solutions, they're just dissolved in water. Your suspensions, they're solid, but you also have to dissolve them in water. Your emulsions, they are suspended in a liquid of fat or oil. And extracts, they're just like a syrup, or they're dried. It's a dried form of medication that, usually has to be evaporated. Your solids, capsules, tablets, your lozenges, and powder. You're also going to have your parenteral use. Remember, parenteral means any kind of medication that needs to be injected. These come in ampules, vials, and cartridges. Your ampules are little glass containers that are sealed. You have to break them open with your, using like a hand. Got to be really careful because it can cut you. Your vial, it's going to contain your medication in it. It has a rubber stopper, and it can be a liquid or a powder. And the powder one, you usually have to, put water or some kind of solution in there to mix everything together. Your cartridges, they're single dose units. I would say that you would use them when you're giving insulin to a patient because they can, it's just a single use, and you can put the insulin in their stomach or however they want it. It's going to be going on your skin, obviously. So you're going to have liniments, lotion, ointments, paste, cream, aerosol. Your liniments, they're suspensions, they're liquid lubrication. Lotions, they're there to protect your skin, moisturize. It's also a liquid. Ointments, they're semi-solid. They're more thicker, like Neosporin. That's a really good ointment to use for bug bites. Paste, it's just a thick ointment, a thicker ointment. Creams, they're emulsions that contain oily bases. Aerosols, they are a fine powder or solution that contains a propellant. Then you have drug forms for your mucous membranes, such as eye drops. You're going to have enemas. You can have douches, mouthwash, throat spray. Those are all for your mucous membranes. Aerosol sprays, such as nebulizers and inhalers. Your nasal drugs, they could be steroids and or vaccines. Suppositories can either be rectally or vaginally inserted, but both are mucous membranes. Special considerations for administering medications to pregnant patients. Before a paramedic administers any medication to a pregnant patient, they will have to consider the benefits and all possible risks to the fetus. The reason being, drugs that are given can cross the placental barrier and harm the fetus. The FDA established a scale that shows the categories of drugs. Category A being the safest for the pregnancy, all the way through X being very harmful. Okay, so here is this picture, and it's just showing the categories of the risk of pregnancy. Category A says controlled studies in humans show no risk to the fetus. Category B, no controlled studies have been conducted in humans. Animal studies show no risk to the fetus. And then all the way down here, it just gets, more unsafe. X, it says controlled studies in both animals and humans demonstrate fetal abnormalities. The risk in pregnant women outweighs any possible benefits. So, you know, you really got to take in consideration of what you're giving your pregnant patients. So always be aware. always be aware of the side effects, because you don't want to be responsible for anything that happens to that baby. You don't want that on their conscience. And the doctors that are taking care of that pregnant patient already know of what drugs can harm that fetus. So they're only taking what that doctor's giving them. So be aware. Be aware. Special considerations for pediatric patients. So there's several things that you have to consider with the pediatric patients. One being age, then you have absorption, distribution, biotransformation, and elimination. Okay? So the paramedics must also be aware that they are tiny little humans. Okay? The considerations being, first age. The effects are unpredictable with infants. Absorption is another one, because there has to be adequate blood flow throughout the body. Infants and young children have smaller muscle mass, and it further complicates absorption. Distribution is another factor in infants, because infants have higher volumes of body water, so it will take higher doses of medication to have an effective blood level outcome. So you also have to worry about this. The drug binding to the receptors, it can create a greater effect or toxicity from the medication. So it can have a negative outcome on our little infant patients. Then we also have biotransformation. This is a factor because infants have decreased ability to metabolize drugs, so they can get a toxicity from the drugs faster, and it can have a very severe effect on their little bodies, and it just takes longer for that medication to be excreted out of their body. So the paramedics must adjust dosages based on their age and their weight. Then we have elimination. So with elimination, you got to think about, infants are small, all their organs are smaller, they're new, and they haven't matured yet. So with elimination in infants, their kidneys, they're not mature yet. So the kidneys excrete toxins, but in infants, it takes them a lot longer because their kidneys are not mature yet. So it takes them a lot longer time to excrete toxins out of their body. So with that being said, whatever medication you're giving to that infant, whatever effects it's having on them, it's going to last longer because it's staying in their body for longer than what you really think. So you just got to be very mindful with giving the infants their medications, and you always have to adjust their medication to their age and their weight. Okay, so we also have special considerations for our older patients. So with older patients, you will have to think of their age. They have less physiologic reserve, such as cardiac function and breathing capacity. They also have decreased renal function, which has a huge impact on medication administration. The absorption in older patients, because older people tend to eat less and or they lack certain nutrients that help aid absorption of the medication. They also may have slower gastric motility because they have less acid in their stomach, or they have, um, something going on in their GI tract. And then you have distribution. That is a consideration because older people usually have less muscle mass because they're not eating as well. They're older. They can't be as fit, as they were when they were younger. So this means it declines the effect of medication distribution because there's not as much blood flow as there was before. So it takes longer. And then biotransformation can be hindered because of liver disorders. When you get older, you've lived your long life, stuff can happen, and I mean, their liver can be, damaged. So that could affect that. Then you have your elimination. Elimination should be considered because of renal problems, and a lot of the times you can see these older patients, they're not peeing as much because they are not taking in anything. So they're not being able to excrete all those toxins out. So it's keeping the toxins inside. It's not letting the medication move out of the body like it should. And then you also have to think about the drug administration problems. So they're older people, a lot of the times you're going to get a little lady in there. She hadn't drank in a couple days. She may have some dementia, and you probably can't even find a vein on her. So you really have to think, well, how am I going to get her to take this medicine? She's not in her mind. She doesn't know that, she should just swallow it. Or maybe she's in a bad mood and she's just saying, no, I'm not going to do it. And then you have a problem where you can't find veins, or you just can't get the IV to go in because she's just so dehydrated. You have to think about those special considerations and what you're going to do, to keep her stable, So those are considerations with our older patients. Okay, now we're going to talk about the nervous system. Okay, so the central nervous system consists of the brain and the spinal cord. The central nervous system also contains nerve impulses that control the body. The peripheral nervous system consists of the cranial and spinal nerves outside of the central nervous system. This all connects all the parts of the body to the central nervous system. Okay? And then here's just a little picture showing you, the cranial nervous system, and then you have the peripheral nervous system to the right. Okay? So the somatic nervous system controls all voluntary control, like the skeletal muscle. Then you have the autonomic nervous system. This is the involuntary control. This is your heart beating, your lungs breathing, your glands salivating. The peripheral nervous system receives stimulus, and the central nervous system acts on the stimulus. Both the somatic and autonomic nervous systems are branches from the peripheral nervous system. The autonomic nervous system has two branches as well: the sympathetic or adrenergic nervous system, and then you have your parasympathetic or your cholinergic nervous system. Both of these terms are interchangeable. So sympathetic can be used for adrenergic. Adrenergic can be used for sympathetic. Parasympathetic can be used for cholinergic. Cholinergic can be put in place for parasympathetic. They are both located at different areas of the central nervous system and exit at different areas. Okay? The sympathetic exits the thoracic lumbar regions, and the parasympathetic exits the cranial and sacral portions of the spinal cord. The sympathetic nervous system prepares the body for stress and emergencies, also called our fight or flight. It raises our heart rate and slows down our GI motility. The parasympathetic slows the body down and works when it in non-emergency state. This is called your feed or breathe reaction. Both work at the same time, but one is more dominant at any given time. The neurotransmitter for the parasympathetic and the sympathetic nervous system is acetylcholine and norepinephrine. And this is my little picture showing the nervous system. You see it says central nervous system. The body's master control unit. Then you have your peripheral nervous system. The body's linked to the outside world. Okay, and then you can see right underneath of each one of them how they're broken up. Okay, so the peripheral nervous system, you have the autonomic nervous system and the somatic nervous system. Okay, then your autonomic nervous system, it breaks down into two branches, and it is the sympathetic nervous system, your fight or flight, or your parasympathetic nervous system, which is your feed or breathe. Okay, and I just want to thank everybody for listening to my lecture. I'll see you next time.